Hello, everyone, and welcome to the season 5, episode 14 of Learning Monday with our guest, Vanessa D'Souza. Vanessa is the CEO of SNEHA. So she'll tell us a little bit about SNEHA and what it stands for and the work that they do. But Vanessa, I'm so delighted to speak with you today. And uh, Firstly, I heard about you from someone who was gushing about the kind of work Sneha had done for them. This is Setco Foundation, the chairperson Urja Shah, and she said, Sneha should just be a guest on your Learning Monday. Vanessa should come and talk about Sneha. So thank you. We're finally doing it.
Thank you, Deepa. It's my pleasure to be on. Thank you for having me over here. Yes, I know Urja is like a good friend, and we've done a lot of work with Setco Foundation over the years. And so it's a delight to actually be on the show today.
Yeah, and Vanessa, your journey, I mean, you've been 30 years first as a banker with Citibank, and then you made a transition at a point in time into social. So it'll be very interesting to understand a little bit about your journey and then your preparation for the social sector. For those who are watching us and were curious to know how you segued from banking to the nonprofit world.
Yeah, so it's an interesting journey, Deepa. I spent 21 years in at Citibank and then decided that I wanted to do something different. I didn't know what it was. I had absolutely no clue it would be the social sector.
Ah,
And while I was thinking about what I wanted to do, the founder of SNEHA actually asked me to come and volunteer with them because they needed somebody to help to fundraise. And in my last role, since I was a private banker, fundraising came relatively easy to me. So I decided to come and help. But I think what was a challenge for me was never having worked in the sector, never having worked in public health. How do you sell a product that you don't know? So I had actually spent time with the organization as a volunteer. I volunteered for 2 years. And I used to go in 2 to 3 days a week. I used to spend time on the field, attend review meetings, research group meetings, read up, and that's how I started learning a little about the organization. And as I got more confident, I started going out, meeting donors, and I think over a period of time, in over about a year, I was quite established in as a volunteer. And then the founder asked me, she said, our existing CEO wants to move on. Would you come be interested in taking over? Now, it's one thing to be a volunteer, but it's very different to be the CEO of an organization, right? Especially an organization you don't know enough of the subject. Anyway, so it took about a year for me to decide. And finally, she said, let's do a deal. You come in for 3 months, you try it out. If you don't like it, you go back to volunteering. And if you like it, you can stay on. So that happened. I came in, and 6 weeks into the trial period, she tells me, I can't give you 6 weeks. You have to decide this weekend because one of the donors that is funding our program on child malnutrition said that if you don't have a full time CEO, we're not renewing the funding. Now, that was a very critical decision, Deepa, because I think for me, what really disturbed me and really got me to volunteer at SNEHA was my first visit to SNEHA's malnutrition program. This was in Dharavi. We all know Dharavi. We've all driven past Dharavi. And I remember when I was told that you're going to a daycare center to see Sneha's work, and at that time, Sneha was doing one of the largest urban malnutrition programs in India. And I went into this daycare center thinking, naively that I would see these young bouncing babies, etc. And what I saw really shocked me. I saw, about 18 to 20 children aged between 1 and 5, sitting there listless, a 2 year old who could barely hold her head up. And I think that really shook me. It shook me because I realized that I used to work 2 kilometers, 3 kilometers away at BKC. And I had no idea that this kind of reality existed so close to me. And, obviously never done anything about it. And I think the fact that the funding for that program was at risk because that really was the issue that really disturbed me. And I thought that was really a concern. And then I decided to continue. And it's been over 12 years now, Deepa, that I've been. So, it was a good decision I made, I think, eventually.
I'm also very curious that you came from a very structured corporate environment, and there is a founder, CEO who obviously has her way of working and a big name and a powerful person also coming with a lot of credibility being a healthcare person. So, how did you eh, navigate that, both in terms of building bridges, working with the founder, aligning with her vision? And taking the organization forward, as well as your natural urge for process, structure, system, scale. How did all that fall into place? What did you have to unlearn? What did you have to learn anew?
So I think that's a very interesting point you make, because I think any shift needs an unlearn before you learn. Yeah. And the social sector, when I came in 2013, when I came in as full time CEO, this was pre CSR. And CSR has brought a lot of structure into the sector. So this was pre CSR. There wasn't structure relative to what I was used to. But I think the founder, I have to give her full credit. She actually gave me a very free hand to actually discover and design the way I wanted to, and that really helped. The second thing is, in the 2 years that I was volunteering, a lot of my own myths and misconceptions about the sector had changed. I
Mhm.
realized that there was such a wealth of wisdom and knowledge on the ground, and it was actually to our benefit to be able to listen and to tap into it. So
Mm.
rather than coming with preconceived ideas about what works in the corporate sector and therefore bringing it into the social sector, instead, if you are willing to keep an open mind and and learn and understand the sector, then you co-design with the people for whom you are creating these solutions.
Great.
And I think that for me was a very big shift. In the corporate sector, we do talk about understanding the end consumer, etc. But once you've understood, you make certain decisions and you go ahead. And I think that definitely is the same kind of principle that we took into the sector, but truly believing that this end consumer, because this is not a for-profit world, right? So it's not like you're paying for a product that is being purchased. You're actually trying to sell a solution which probably the end user isn't even aware of. So you have
Yeah.
to create these. So, for example, if you're working with a survivor of violence, she doesn't even know that what is happening to her is not acceptable. Yeah? So you have to actually turn things upside down for her to make her understand that before you even come up with a solution. So I think that kind of the openness about learning from the sector and then working collaboratively with people in the sector is what really helped me.
Yeah. And I think Vanessa, SNEHA has stayed focused in geographies. So, what is the geographical spread, and how did you sort of stay to that core of what is the area that you were servicing, and how did you then um, you know, partner with other organizations? Because I think Sneha also does a fantastic job with strategic partnerships, both with government as well as other organizations. So tell us a
Yeah.
little bit about that, because collaborations, I think, is a great piece for an impact multiplier, isn't it, in your
Yeah.
sector, particularly when you're dealing with big problems.
That's right. So I think one of the big advantages for Sneha is that the founding team of doctors was from the public health system. So they were from Sion Hospital, KEM Hospital. They understood the strengths of the system as well as what needed to be done. And there was a very high level of trust that they had. So our founder was the former dean of Sion Hospital. So I think that was an important principle for us to take forward, saying there is strength in a public system, and how do we build on those strengths while we also address the challenges that exist. Yeah? And I think that's one big principle that has worked. But to come back to your first question, Deepa, on our focus area remains what we call preventive and promotive healthcare. The mother and the child continue to be the primary focus because we do believe in vulnerable communities. They are the most vulnerable members of the family. Yeah. So we've always kept maternal child health, adolescent health, and violence prevention as our core of our work. Yeah. Now, if you think of Mumbai as a city, 60% of Mumbai lives in informal settlements, right? What we call vulnerable or what we call slum communities. These are large populations. So, for example, when we started working on the malnutrition program in Dharavi, at that time, the official number of the population was 300,000. Whereas when we actually started working, and this was between 2012 to 16, we found the actual population was closer to a million. So these slum pockets are really large. In fact, I don't think any NGO can work even in an entire slum pocket. I know in the nutrition program we tried to work on the whole of Dharavi, and we did for 3 years, but that's huge. You can't do it on a sustained basis. So we decided to focus on urban settlement or urban areas and peri-urban areas. So right now we work in the adjacent Greater Mumbai areas of Vasai Virar, Bhivandi, Thane, etc. And these are what we call our direct intervention spaces, where we work with communities, we work with community volunteers, as well as with public systems. But if we, as we work, and again, another strength of SNEHA is that we work with a lot of data. So we build what we call evidence-based models. Right? So if I have to, for example, if I have to address urban malnutrition in children, then I will create a model on how to address urban malnutrition in children. This model can then be taken to other cities, to peri-urban areas, to rural areas, but with some adaptations, of course, based on the local context. So we felt if that is our strength, building models is our strength, then instead of us going and replicating, can we find suitable government partners or NGO partners that we take these models to? We collaboratively design the intervention for their local context. Because also remember, an NGO working in an area for many years understands that population, the beliefs, the misconceptions, it understands the stakeholders over there, and has trust in the community. Because a lot of the work we do is behavior change. So if you
Yeah.
cannot build trust overnight, so if we can leverage off the trust they've built and their own knowledge of the area, then your time to success reduces considerably. So we work then, we design the model together. We have very clear objectives that we want to achieve with that partner on the ground. And we do quite a bit of profiling even before we finalize a partner.
Uh-huh.
Because you need to philosophically be on the same page as that organization.
Yeah.
You want to make sure that that organization really wants to make impact on the ground. It's not a couple of boxes that they just want to tick on the work they're doing.
Correct.
And they have to be interested in working on that issue for at least 3 years, because these are
Mm.
protracted problems. You
Yeah.
cannot change reduce malnutrition or reduce domestic violence in a 1 year intervention. So
Correct.
we spend a lot of time. We actually go physically to those locations, understand the context, understand the partner, not just at the founder level, but right down to the people on the ground. Do they
Correct.
really want to work on domestic violence? Do they really want to work on child malnutrition? And only if they want to work at every level of the organization, is it worth us then investing and spending time to build out a model for them. So we do a lot of that investment. And I think that's how we're able to identify good partners. Then we have, and it could be government or it could be an NGO partner. And then we go into the whole scaling process. And therefore, we have a few partners, but they are strategic partners. They are longer term partnerships where we can actually say at the end of the intervention period, we're very clear outcomes and we're able to achieve those outcomes. So if you take the example of Setco Foundation that we worked 3 years with them. But if you look at their website and their annual report, you'll see, they're actually able to consistently keep child malnutrition at very low levels in the areas they're working on.
Yeah.
So then we feel that, we built this model and now the organization is able to sustain their work. This is far more cost effective, both for us as well as the organization on the ground. And you're also able then to leverage the learning. So we do this with the government. So right now we're doing a partnership with the Department of Women and Child Development in Daman, Diu, and Dadra Nagar Haveli, the whole Union Territory. Just to give you a sense of size, the whole Union Territory has 410 Anganwadis, which are the government childcare centers, whereas just Dharavi alone has 300. So to give you a sense, people think that, oh, you're only working in Mumbai. Mumbai has about 5,000. Yeah. So if I work in, say, just Mumbai, the M ward, which is Mankod, Govandi, a lot of us hear these names, they have over 800 Anganwadis. Yeah. So to give you a sense of the scale of work in Mumbai compared to some of, say, an entire union territory is so different. And therefore, working in Mumbai is actually extremely challenging
Yeah.
because of the scale of the work.
Yeah. Yeah. Also, this is fabulous. The perspective that you bring in on, adolescent, like every age, every cohort, every stakeholder is very, very unique. I was aware up to the nutrition and the health, but I wasn't aware of the violence prevention. Do you want to talk about that a little bit? For
Sure.
some reason, I wasn't exposed to it probably at Setco. But
Sure. So it's very interesting. Our founder actually decided when she retired from Zion Hospital, there were two things she wanted to work on. She was a neonatologist, and, she used to see these very premature babies, 800, 900 grams. Many wouldn't survive. Many who survived would go home with all kinds of cognitive development. That's why she decided, let's work with pregnant women so that we can prevent this happening and babies are born healthy. And the second thing she saw a lot of was domestic violence in mothers. Yeah, and during pregnancy. And that's why when SNEHA was founded in 1999, these were the two areas that SNEHA decided to work on. And this was way before issues of violence, gender, etc., we even talked about. Now, the reason that SNEHA was decided to actually, we have what we call an integrated approach, which means I start with adolescents. So we work from 11 to 19-year-olds. We work on physical, reproductive health, gender, as well as gender based violence, because anemia actually starts at that age. Yeah? Your gender perspectives start at that age. Your attitude towards gender based violence starts at that age. So, how do you create at that stage itself, how do we build, and mental health, we work in mental health as well of adolescents. So we start at that age. Then we go to what we call the preconception care. So this is newly married couples. Again, we work on violence prevention for newly married couples because you don't want violence to happen and then be addressing. How can we prevent this from happening? And then at preconception stage, addressing reproductive health, anemia, so that when the woman gets pregnant, she's healthy. Yeah, so you facilitate, you promote a healthy birth. Then we work through the period of pregnancy and then young childhood because of with malnutrition. Now, the reason we actually integrated, so earlier, Deepa, we used to have discrete programs, right? I'd
okay.
work in one location only on violence and one only on malnutrition. And interestingly, in the malnutrition program, when we were working in Dharavi, we found that there was a cohort of children that though we were intervening with all the right protocols, we were not able to bring those children out of malnutrition.
Mhm.
So then we did a qualitative study, and we found that in those 4% of children, they were actually dysfunctional families. So it could have
Okay.
been domestic violence, maybe she was the second wife. So the mother's caregiving ability was impacted. Yeah. And that's
Mm.
when we decided that if you have to work on an issue of malnutrition, you have to also work with the mother on domestic violence and mental health. Yeah? Now we integrated. So when our frontline worker goes home, she counsels the woman on pregnancy, on malnutrition, on child nutrition, but she's also picking up signals of, say, mental health issues. It could be mild anxiety or depression. It could be domestic violence. And once she picks up these signals, her role is then to make sure that that woman reaches a counseling center. And we have counseling centers in these slum communities as well as in public hospitals, because the most severe cases of violence actually reach the Sion Hospital, KEM, Nair, etc. Those are cases of burns, their sexual abuse, their fractures. So we have counseling centers there, and we train the public hospital staff there to not just treat the symptom, but if the symptom is caused due to violence, and how do you make sure the woman gets referred to counseling centers in the hospitals so that women then don't have a recurrence of such severe violence. Yeah? So we've integrated our program on violence in the community, in the public system, to make sure that at all levels, women then get addressed on the issue of violence. Now, what has come out very interestingly, Deepa, is if you correlate data of women, say, for example, we work on planned parenthood, or better known as family planning, to make sure that there is spacing between children. we find that based on data that women who are facing violence have much less agency, and their ability to adopt any form of family planning is much less than a woman not facing violence. Right? It's intuitive, but when data says it, then you know for a fact that your intuition has been validated. Similarly, we see higher levels of stunting in mothers facing violence compared to mothers who don't face violence. And it's quite significant. For example, it's 51% of children of mothers facing violence face stunting, which is a form of malnutrition, compared to 35% in mothers who don't face violence. Right? Now, why this is critical is then if I know that a mother's facing violence, I need that additional layer of intervention through my violence prevention counselor, through sometimes a government frontline worker, sometimes a medical doctor, who then goes and gives this woman a far more comprehensive and in-depth intervention, because she is at risk for multiple factors and not just her child just not having the right dietary intake. Yeah? And therefore and I think the government has also realized this, because now the government themselves has been bringing us in to do training of asha workers, of anganwadi workers, so that they are aware and then they can provide that right level of help to mothers facing violence.
And when in the cases of violence, then police also become the partners
Yes.
of sorts.
That's right. In any intervention we do, you cannot work without the public system. So we have ASHA workers for health, we have Anganwadi workers for nutrition, we have police for violence prevention, as well as the District Legal Services Authority. So
Wow.
now we've reached a point where we've trained police. So between 2016 to 18, actually we trained all police from all police stations of Mumbai. But now what we do is we have in police stations, in our intervention areas, we have what we call demo centers, where our community volunteers are actually sitting in the police stations. So when women come in, women who want to file cases, they actually have one of their peers from the community sitting there, so they can help them to file the case. Otherwise it can be very intimidating for a woman.
Intimidating. Yeah.
Yeah, so here we've actually integrated, and I have to thank the police for allowing us to do something like this, because it does provide that extra layer of help to the woman as well. Plus, every Saturday, the police have an open forum where members of the community can come in and bring any of their problems. It could be related to property, family disputes, it's violence. We have our volunteers who sit in those meetings who can actually support the women, because there is sometimes follow up needed, there's sometimes documentation needed. So, actually help them then negotiate some of their problems. So, in a way, we're very, very integrated with the public systems.
Phenomenal. I mean, in the short span of time, Vanessa, you've given us a very good overview of the true integration between and the connections between each of these uh, problems and how they actually spill over into the others or could become a trigger. What are some of the biggest challenges that you face at SNEHA at this point in time?
I think funding is always a challenge, Deepa. Any non-profit has that, because you start an intervention, and let's take you're working on a program of malnutrition, right? You have funding, unfortunately, that only comes in through CSR 1 year at a time. But your program could extend for 3 to 5 years, depending on how much you're able to bring down malnutrition. Now, if funding is not consistent, we cannot stop the intervention, because these are all protocolized interventions. Yeah? So having a constant steady state, have constant steady funding is very critical. Long-term funding. Uh, it's not just program funding, but you also need to fund organization capacity building. So,
Yeah.
for example, I need funding for technology, I need for research, I need monitoring and evaluation. Otherwise, how do I know and how do I measure my progress if I don't have a team that's actually able to do this independently?
Correct.
So, one of the other challenges is most donors want to give money for the intervention, but the minute you want to build, allocate funds for organization capacity building, they say, find some other donor. But it's not easy to find those donors. Yeah? The
Correct.
second challenge is that, especially at senior management, it's hard to get the right people who align with the cause and with the organization. Yeah? You have social workers. Social workers are fabulous. They're passionate. They work very well in program implementation. But you also need to build the organization as you scale. So if you want quality people in finance and HR and technology, it's hard to get those people because you don't pay as much. They don't see this as career growth. It almost is seen as somebody who wants a more chilled out job. But that's not the reality. In fact, I think a role in a nonprofit is far more demanding because we are much more resource constrained. But you also, there's tremendous learning because as if you're in finance and you have to understand HR, you have to understand programs, you have to understand technology, which maybe you don't need to do in the corporate sector. So getting people who have that passion to work not only for the cause but are open to learning on cross-functional learning, I think is another big challenge we have. And the third is, as you scale, a lot of donors want to chase numbers, yeah, but
Mm.
quality is more important than numbers. At the end of the day, it's easy to chase
So good.
numbers,
Yeah.
yeah,
Such an
but
important
yeah,
point you made.
there
Yeah.
are actually three types of scaling the way we look at it. One is what we call scaling up, which is how do you change policy, advocacy, etc. Second is scaling wide, where you keep increasing the geographic coverage, and the third is what we call scaling deep, where you start with one issue, but you start layering issues on it. Because, like I shared with you, if I want to work on malnutrition, there are other issues. There's sanitation, hygiene, there's family planning, there's violence prevention. How do I then go deep? How do I actually shift the needle in a community? So I create awareness in a community on violence prevention, on malnutrition, on healthy eating, on sanitation, so that ultimately, at the end of my 3 to 5 years, when I'm ready to leave that community, my community has a different perspective and they can take that forward. Otherwise, we'll never be able to leave an intervention area. So, therefore, the need when as a donor or any stakeholder to look at scaling not just in terms of numbers but in terms of depth and quality is, I think, equally important. And that isn't always the case, for all donors. I mean, it's a matter of education and knowledge, and the need to engage deeper in the sector for you to really understand what the needs of the sector are.
And post-pandemic, did you see any big shifts in the way the community behaves, or how easy or difficult it is now to, technology adoption and therefore faster behavior change, or adolescent girls just being more informed and therefore easier to influence positively? Do you see any of
So
those?
we have seen definite changes in terms of health becoming a priority. Okay, that's
Mm.
one very important thing, right? Otherwise, for
Wow.
the poor, livelihood and their children's education is number one priority. Now, at least you can talk health and they understand. The public systems, we've seen a big shift in the public systems because primary health had needed a lot of investment. And we've seen a lot of investment and not just investment, but importance being given to primary health post pandemic. The second big change we've seen is in terms of hygiene and sanitation. Both from the community, hand wash has suddenly become something that people understand here, as well as from the public system. We have seen so much of increased sanitation, toilets being set up, water taps being put in, lanes in the slums being paved, so that focus on clearing of garbage, sanitation. So all wash has definitely, that focus has definitely changed
Fabulous.
post
Yeah.
sanitation. The third is digital penetration. Yeah. Today, in every slum community we work, over 90% of the women have access to a phone. About 50 to 60 have their own phone, and the balance have, say, what we call a family phone, right? Because the husband, the kids all use the phone. So digital penetration is huge. Digital literacy has definitely increased. So we have started doing, in fact, from the pandemic, initially we were just doing simple SMS messages. Now we're looking at, we're piloting chatbots, two-way WhatsApp chatbots using AI ML. So you can actually use the technology a lot more today than probably you could use it pre-pandemic.
Fantastic. Very good. The last minute, Vanessa, quick call for action for our viewers.
So I think, Deepa, I would like people to keep an open mind, to keep themselves informed. We have certain which even I had, preconceived notions about the sector. How do we dispel? The only way to dispel these notions is by actually engaging, understanding, visiting. I would say come and visit, because if you visit a couple of NGOs and you understand the work on the ground, two things will happen. One is, I think your own idea, your own knowledge increases. Two is you connect with a cause. And then you realize that there are so many ways to give back. Money is not the only way. You can give by talking. I mean, a show like this helps to create advocacy about an issue, right? You can talk about an issue. You can bring special skills. We've had volunteers bringing amazing skills into the organization just by working a few hours in the month. So there are multiple things you can do at your family level, at a local level, and of course at a larger level. And I think ultimately it's, like everybody says, you must be feeling so good to give back. I don't think so. I actually think I get more than I give back.
So good. Wonderful. What a great perspective you've given us, Vanessa. And hats off to the work that you do and the kind of impact you make. And I look forward to following your work, learning more, and maybe visiting the center sometime.
Thank you, Deepa. Thank you for having me on this show. Thank you.
Thank you.